Now, there's another way in which you can be able to diagnose or confirm that trichomoniasis actually exists in a patient, and this is what is known as a wet mount. So wet mount, that's wet mount microscopy, right? To be full, it's used in diagnosing trichomoniasis. So let's look at this modality of diagnosis, talk about how it is done, okay, and its importance. So for wet mounts, we said that it's a cost-effective microscopic test. So you use it to actually pick up trichomoniasis infections, right? Which is a common sexually transmitted infection caused by a protozoa and parasite known as Trichomonas vaginalis. So for wet mounts, the procedure is this: you just have to collect the sample, which is usually vaginal swab, from the patient that is affected. Now the swab is usually mixed with a drop of saline. Okay, they do that on a glass slide, you know. So microscopic examination, the slide will now be examined under the microscope immediately. All right, the goal is to detail the trichomonads as they are moving. Okay, so they are pear-shaped organisms. They move in a jerky. Okay, they have flagella. All right, I didn't actually bring their picture. All right, but this is how a wet mount view on a microscope will look like. All right, so findings: if it is positive, there's presence of Trichomonas vaginalis and they are moving. If it is negative, there's no movement. Okay, so it's sensitive. 50 to 70% of cases you should be able to pick your diagnosis. Okay, so limitations: parasite lose motility quickly. That's how you have to examine it immediately, so you can miss out. Okay, so other alternatives is nucleic acid amplification test, is more specific. Cultures, then rapid antigen tests. Okay, so clinical clues: if you also see a yellow-green discharge, if the vagina is irritated, then there's painful urination, then the pH, if it is more than 4.5, okay, to be specific, then whiff test may be positive. Okay, that's you add other potassium hydroxide to it.